There we go.
Hello, everyone.
Recording in progress.
Oh, sorry, guy. Hello, everyone. We are so happy to have Dr. Fabio Grassia here. Um, and we just wanted to thank everyone to be always with us with Med School Mentor. This is one of our, I think, 23rd or something webinar that we have with like leader in medicine. Dr. Fabio Grassia is originally from Sicily, and he began his medical career in Italy, earning his medical degree at University of Catania and specializing in neurosurgery at University of Milan. And after obtaining his medical license, he moved to the US. And now he's the chief of neurosurgery at Denver Health Medical Center in Colorado.
Mhm.
And at just 39, he's one of the youngest neurosurgery chief in the world. And I have to say that I'm so honored to have him because I'm Italian, and having him as like a figure of excellence of Italian neurosurgery here, it's just amazing. And I can't believe we have you, Dr. Fabio. Thank you so much.
Oh, thank you. Thank you for the kind words and introduction. It's so kind.
So I just want to remind everyone that the webinar is registered, so you will find it on YouTube later. So we want to start with the first question. So how did this, how and why you decide to come here in the US? But first of all, we would like to like invite you before describing us why did you came here to take a few step back and share with us a little about your background and journey, not only as a physician but also as a person. So, who was Fabio Grassia before medicine and neurosurgery, and what experience shaped the person that you are now?
Okay, that's a long question to answer, but I will try to be brief. Uh, I was born in Sicily and in a little town, it's called Bronte, which is very famous for pistachios. Actually, they have the best in the world. They have something similar in California, believe it or not. Um, and so I always wanted to be a doctor. Um, and I always looked at US as the place to be. And as European, we grew up in I grew up in the 90s and 2000s. So I was born in 86. So 96, I was like 10, 11 year old. And this is when I started, being exposed to TV and everybody watched the American movies. So that's how my idea of US was. Now, it was completely right? Not, but it was not totally wrong. It was kind of a mix, and I made my own idea growing, and I always wanted to come here and try to work. Um, I did everything in Italy, at least when I say everything, I would say the med school and my residency as well. But when I was in med school, I already was looking on, number one, I had to learn English because in Italy, uh, you will do some English class in school, but it's not, good enough to be and work in America, right? And so I started going to London at the time and trying to work odd jobs and do whatever I could to learn the language and start knowing about what it needs to be done to be a doctor in US. So one of the things that came was the USMLE, right? The United States Licensed Medical Examination, which was to be such a weird and difficult things to do because of language barrier and the way we study in Italy is way different. And it's not better or worse. We study the same things, just we do it in a way that doesn't not prepare you to do the USMLE. But anyway, during that time, I was trying to look how can I get to America, and I was online, and a website pop up, and the website is called Giovanni Armenise Harvard Foundation, which is a group of Italian scientists slash now Italian Americans who have this. program based at Harvard. Brief story: Giovanni Armanise is I think he's still alive, or anyway was an Italian noble, was a count, and his wife had a very terrible brain disease. It was a glioblastoma. So he went to Milan. They told him, well, we do surgery, but the prognosis is what it is. So he said, like, nah, that's not gonna work. It's the same Italian things. So let's go to the best place in the world. Let's go to Mass General. And the Mass General told them, yeah, we can do surgery. The prognosis is still 12 to 16 months. So he was so impressed about that. They said, like, wow, so Italians are not so stupid. So they told me the same things the Americans are telling me. So he donated a lot of money to the Harvard Medical School with that one condition, that every year they were sponsoring three Italian students, one medical student that needs this to be from fourth, fifth, or sixth year, and two general scientists, like after you get a bachelor degree in biology, chemistry, whatever, then you do a specialization in that, which is at the 2 years, a master's. So you have to be already a master student, a science master student they were going to go there through a selection to spend a few months at the Harvard. So I said, like, well, I come from a small town. Who cares? I'm gonna try. I applied and I won. I went to the Brigham and Women's Hospital. I was the only one of the three students in Italy who got there, and I was working with a great mentor. His name is Alexandra Golbi. She's a great person, and I met great Italian excellence, Paolo Pandolfi, who is still at the Harvard doing like cancer research and other people like that. So that was my first experience in America. And it was insane because you were in the place where Harvey Cushing was and all these very, very important people. I was in the same room because at Brigham and Women's Hospital, there where they do the ground rounds, you have the picture of Harvey Cushing right there, which he was in that place. And so with other incredible people. Um, After that, I said, like, okay, there's no doubt I have to come and work here. So I went back to Italy. I finished, sorry, my first step for the USMLE. I did it in Rome. And then decision was, well, what are you gonna do? You finish everything in America, you finish your steps and trying to get the residency over there. And at that time, for me, the decision was to stay in Italy and do the residency there. And it was more of a financial decision, honestly, and how difficult it was going to be for me to stay 2 years without working, trying to do the USMLE. So, long story short, I got a spot, I think, in one of the best residency programs in Italy, hands down. And there's not much to debate about it, which is the University of Milan. And he's not the best, he's one of the best in Italy for sure. Great mentors, great names, and a lot of things were happening. And so while I was there on my PGY3, my director of residency at the time, who knew that I wanted to come to US, told me, do you want to spend some time in America? Because I know, you could go to Seattle and face do some research over there. I said, yes, I went to Seattle and I was in a children's hospital in Seattle and I started my research in pediatric epilepsy, imaging pre and post surgery. I was able to publish through papers and I met a guy who changed my life, two guys. One was the chief of pediatric neurosurgery, epilepsy pediatric, which his name is Jeffrey Hodgman, which is the son of George Hodgman, who basically invented with Painfield the epilepsy surgery, right? And then he invited me home for Thanksgiving, and his little brother, name is Stephen Hodgman, was there eating and told me, Fabio, I mean, I heard you both, are basically bothering everybody that you want to work in US. I cannot offer you a job, but where year are you? I said, like, I'm PGY3. Actually, I'm almost PGY4. They're like, okay, so I cannot offer you a job, but I can offer you a fellowship in epilepsy surgery and functional surgery. I was like, okay, when you finish it, 2019, he told me, I have a spot in 2020. That was 2017. So we're talking 3 years prior. I said, like, okay, sign me up. I will finish my USMLE and I'm gonna be there. So I go back to Italy. I finished my residency. Like my last year, I did my chief resident year, which was kind of an enfolded fellowship in skull base and vascular, in with Dr. Paolo Ferroli and Francesco Cerbi at the Besta Institute of Milan. Arguably, I guess, one of the top European place for skull base and vascular as of right now. And I learned so much. They do 1,000 skull base and tumor cases a year. Not only also gliomas, but they do a lot of skull base and vascular. They are the main Moya center in Italy. They do 4 bypasses a month. So and I was the only one. They had anybody else. So while I was there, I was able to acquire that expertise as well, and then I was ready to leave, and COVID hit. So I delayed my leaving for I was stay there for another 2 3 months. I was a doctor in Milan for emergency in COVID at Garbagnate, one of the hospitals that were designed as a COVID hospital during COVID. And then on June 15, I jumped on a flight and I came to America. I did my fellowship with Steve Ogeman in epilepsy, and I learned so much. And almost at the end of the fellowship, when I was almost ready to do another fellowship because I didn't want to go back home, Denver Health, where I was going and taking calls for free, just to let people know me, called me and told me that one of the surgeons actually left. We will need somebody who come here and keep helping with epilepsy surgery and building a brain tumor program. Trying to do to Denver Health is a safety net hospital. Safety net hospital means that we treat people that nobody else want to treat. They are uninsured. They have terrible social situation. There is the majority of our population is a Medicaid, so it's a very 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 particular hospital. And many safety net hospital, they don't have a lot of specialized program. So we build a level 4 epilepsy center, which is the maximum level for epilepsy center in that you have. Level 4 is the top, where you have an in-house basically epilepsy surgeon. You have an EMU. We have a ROSA robot and all the things that you have for that. And slowly I built up brain tumor program, where now we do a decent amount of those. And I hope to get bigger. We cooperate very well with the University of Colorado. I'm an assistant professor there. I told you I hopefully gonna be associate in next year. And I teach at the university. They have amazing surgeon at the University of Colorado. We cooperate for brain tumor. They just hired a new chair, Dr. Fetchik, who is amazing. And they have, their own skull-based program, their own tumor program. We always cooperating. I send patient to them. I ask for any possible things that you can imagine to cooperate. Because my idea, it was to make this place a family. There was not. So we actually become a huge family, even with the hospital that usually they only partner with us, sending us the residents in 4 months. But now we were able to build up even a better relationship where we can actually, increase our volume and share patients and making sure that, all the both places, are happy with each other. So that's my story.
That's
Perfect. Thank you.
amazing.
Yeah. Thank you so much for sharing your story. And something that I like is to see that everyone has a different path, you know. And as also an IMG, I'm really glad to be able to see and hear from you about your history. And so since you talk about all the way you moved to the United States, all your path through here, like for you as an Italian, what was your biggest challenge that you faced moving to the United States? Like going to a completely different healthcare system and like beyond your profession, it's a different lifestyle. How was it for you? How have you handled it?
Um, it was hard, and it was hard because I mean, all of a sudden you go from a place where you have your family around. Even if I was in Milan, my family was 1 hour and a half away. I can get on a flight and get home to 1 hour and a half to a place where uh, Denver, Rome is 10 hours flight, plus you have to go to Rome and then get a flight to go to Sicily. It took me like all night and part of the day after, to get home. Um, it's definitely different. I realized that you have to you have to adapt yourself. This is how our how why human beings are very special, because we adapt pretty fast. If you could take a polar bear and you put him in the savannah, he's gonna die in the next 3 or 4, maybe a month or so. If I take somebody who lives in the North Pole and I put him in the equator, he's gonna survive, because human being knows how to adapt that in a very short period of time. That's the main difference that we have. We're not better or worse, and we are not even much smarter than animals. We just have a great way to adapt pretty fast. So what I did is just I had to, come to Jesus, how people used to like to say here, and adapt with all the changes. On the healthcare perspective, I had good thing. I had bad stuff happening, right? You go to a place, from a place like Italy, where everybody get cares the best. Doesn't matter if you have insurance or not. You have to wait, because in Italy, unfortunately, the wait lists are very long, because when everything is for free for everybody, sometimes it's not exactly the always for everybody. Everything, when something is for everybody, sometimes it can be for nobody. So, but no. Nevertheless, if you wait, you're gonna get good care. If you go to the hospital, nobody's gonna ask you a credit card. So I went from there to a place where I had to say sometimes no, because insurance wasn't approved, and I have to talk to insurance every day, do peer to peer. It is a terrible word that whoever works in America as a doctor have done once in his lifetime. I can tell you every day, where you have to explain another doctor on the other line why you are making a decision, and why and they have to tell you why they think that is they don't gonna pay for it. So that is something that at the beginning was hard, but Denver Health make this transition very smooth, because when you come to Denver Health, my patient 50% is Spanish speaking. 50%. You have no money, doesn't matter. You're gonna get the care. I done brain tumors, epilepsy surgery in people that have nothing. They cannot speak the language. They are just, struggling with like everything. So basically, that from a doctor standpoint, from a financial standpoint, is not great, but for a doctor standpoint, helped me to do the transition easily, because I was actually fulfilled to the fact that, I mean, I don't mind what is around me. What I'm seeing over here is that I'm helping people that otherwise would have no other choice. And with me and with my people and Denver Health, they do have a choice. So that is actually a very, very good way to have this passage from a full governmental healthcare in Italy to a basically fully private in America. Safety net hospital are kind of middle ground, where actually, they they still can help everybody.
Thank you so much.
You're welcome.
Thank you for that answer. I love that. It sounds like you've had some amazing mentors. I'm curious if you could talk about what key figures influenced your development most, and how do they guide and support you to what you've done in your life?
Do you mean what they did to me, or in general? I mean, what?
More in general, like how do they guide you?
So these are a great question, and there is few things actually. When you are uh, a young person trying to to find your place in the world, you have there's two choices. One is, you think that you are self-made, and you tell the story around the world, and you will have people who believe you. There is no self-made. It doesn't exist. It's a terrible word. Self-made, it's the worst word I ever heard in my life. And it's a propaganda word. It doesn't exist, self-made. And let me tell you why. I could have been the most smart, intelligent person in the world, which I'm not. But without having the right people who believed in me, who opened the door, who did not close the door, who gave me, who opened their houses, who shared their knowledge, who made a phone call on my behalf when I needed, There was no way in the world that I could work. Small story. When I go to Denver Health, as a foreigner, I had to, a foreigner not trained in US entirely beside the fellowship, you have to go through something called alternate pathway with the American College of Surgeons, who they have to approve you to take trauma calls. Denver Health is a level 1 trauma center, the busiest trauma centers in Colorado. Okay. The chief of neurosurgery at that time completely messed up my application. And so the College of Surgeons did not review it. So what they sent in the email was, okay, this guy cannot take trauma calls because we couldn't review him because there's a piece of documentation that are missed. Everybody around me, the director of the department, vouched for me and said, like, we don't want to send this guy anywhere. We believe in this dude. We're going to have him over here. And in 6 months, when you guys are ready, we're going to resubmit everything and you're going to re-review him. So if I did not have them, I could have been fired and said, like, okay, if you cannot take call in a trauma center, why should we keep you over here? They didn't know. I mean, why they should? So that's what I'm saying. You always have to have people who vouch for you. And if you are, and I'm a surgeon, sometimes I think there is a surgeon among every doctor are the worst, because a surgeon, there is a, have you ever watched the movie Malice with Alec Baldwin and Nicole Kidman? There is a scene where he is they are talking about what he did something very terrible, and he basically is arguing with the board, saying that, oh, if you were looking for God, he was in operating room number 2. Like, he doesn't like to be second guessed. That is the picture of a surgeon, and is the worst picture you can have. And unfortunately, the best things, if you think that you are self-made, you're the best, that you're going to make it, without mentors, friends, people around you, you're not going anywhere. And this is as an advice to everybody: when you meet somebody who just brags about how good he is and how he's gonna, he did everything himself, run on the opposite side of the room. That's a lie.
Thank you. That was great. Thank you.
Thank you, Dr. Grassia. So, also had a question. You mentioned how you were able to, so you interned for a bit at Brigham, and that just cemented the fact that you really felt like you needed to be at the US. And I guess my question is, how has research impacted your journey since then? Since it kicked off your interest in being here, how has that shaped your trajectory after you in Italy and then after you moved to the US?
I couldn't hear you well. You said the research?
Yes.
Oh yeah, I mean, I think is fantastic, right? It changed a lot. I mean, if I compared what I was exposed when I was in Italy and when I came to US, you cannot even compare it. I remember I was a medical student and then a resident, and it was so much things to do when I was a resident, and there was basically zero time for me for research. And I is something that I say myself, I'm first a surgeon and then I'm a scientist, but this is what I am. I don't sell myself to be a scientist. I'm a surgeon. I know how to use my hand. That is my job. I'm a carpenter of the brain. That's what I do. It's not even so difficult. The problem is, when I came to US, the people around you, they push you to do something more. I remember I was in Seattle, and I was in this neuroimaging lab with this amazing engineer. His name is Andrew Polakiov at the Children's Hospital. Is one of my friends. He's a great man. And in just 3 months, 4 months, 5 months, we published 3 papers on JNS speeds, like right away. I was one is my first name. The other one was my DTI. I've been interested in DTI for so long. Was the front page of JNS of epilepsy, actually, of JNS speeds. I don't remember one of those, but the story is that you have people around. That's what to go back to Clayton, is like, when you have people around you who give you the chances and opportunity and the tools, That's yes. I mean, if you're not ready, it's on you. But if you don't have these, I was the same in Italy, and don't make me wrong, I was working my ass off and doing whatever I could. But when you see people really believing in you and give you the tools, oh my God, whatever you can do. So the research impacted a lot. And then when I was a fellow with Dr. Steve Hodgman, we were publishing so much. Then I became we did so much in send a lot of papers about like functional neurosurgery. Then for a brief period of time I was the director of the CSF dynamic clinic at the University of Colorado. Right after I got a job, they needed this, and I started that, and with the neuroradiologist who was an expert in CSF dynamic, we started publishing paper about CSF leaks. And so as you see, it's such a I'm very versatile. If I'm in an environment where people are excited about something, even if I don't know much, I'm gonna adapt myself and trying to work with them, because the only thing you can do in our job is learn. So the moment you stop learning, research, remember this, research, it doesn't help the word learning. The research helps you learning first. And so you can share what you learn with the rest of the world. That is very important. You don't do a favor to the world, you do a favor to yourself. So this is what I learned, and it took me time to learn this.
I really like that. Thank you.
So, to follow back this question on research, I'm wondering, because you work both with brain tumor and functional neurosurgery, do you think that clinical research is in a way better for young students than basic science to have a first glance of what research is? And also, how do you like consider now the necessity for a lot of students, especially from international, to have like more papers, like having sometimes more quantity than quality on your own
Mm-hmm,
curricula?
mm-hmm, mm-hmm, mm-hmm. Okay. I'm gonna say something, and what I'm gonna say, I don't care. Whatever any other, I tell you what it is. This insane idea to publish 500 papers on nothing, which means that publishing a paper about how you use the fork to eat your pasta, it doesn't help anything. Now you're gonna have a paper more in your CV. Is this impacting your impact factor? Is impacting? I want to remind everybody in the room, the latest Nobel Prize winner won the Nobel Prize with 34 papers, not with 340, 34. 34 papers, and she won the Nobel Prize. Please be careful. I'm in line. I was talking with the chair of the university about it, and we were saying the same. It's when we look at papers to applicant for neurosurgery, there's people who start publishing, in anything, 2 billions, like peripheral system, functional, spine, OBGY. Like they think that's not, for me, that's not quality. Be mindful and be careful. I want you guys publish on things that make sense, and actually you spending time, and it's gonna make it's gonna improve something. Publishing about nothing, and this is one of the main problem. I don't know if you guys just to go online and look. It's been a very, very big debate. There's everybody sending paper on whatever, everything. I mean, when I read a paper, I want to learn something. If the paper doesn't teach me anything, and it's the same things that was done yesterday, they just change the way the word goes and put it back just because they want another paper. That's okay. Let's have fun. But doesn't make you a resident. If I have to choose, for me, what I choose in a resident is how resilient you are. Can you bear with the pressure? Do you have a good personality? Do you have a good you react good under pressure? Can you work on a team? Then you have the 250 papers, and you are unable to be a social individual. You don't want to get a job, I promise to you. because that's not what it makes. So what I say, publishing is important. Put your name out there is important. You guys want to be a surgeon one day, learn how to be a surgeon, learn how to do not kill people, learn how to do the best for the patient, and publish things that make sense. That your name is, people are good. That's how your paper get reported. You read a paper and you do a citation on the paper because actually makes sense for what you're doing right now. But if you publish 60 papers about, you know, Mickey Mouse, I'm sorry, like that doesn't make any impact. So it doesn't make you a better resident. So this is something that I want to highlight very, 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 deep.
Okay, thank you. And you said regarding the like clinical versus basic science, what do you
I
think?
think it doesn't matter. Honestly,
Okay.
I think basic science is very important. And
Mm,
I think if I had to do basic science, I would do basic science as a med student and
mm,
then go to more clinical when actually you can, have more involvement with patients. But I think both of them are fantastic. I think there
okay.
is not advancement in science without basic science. It doesn't work. I mean, you need to have your rats first before you go to humans. That is what I mean. If you haven't watched, I urge you to watch this Netflix special called The Bad Surgeon. It's something that I would really need you guys to go and watch it, right? This guy, Italian, unfortunately, with the Karolinska Institute, hired without looking at anything about his background. Like he was transplanting, basically plastic pipes, saying
Yeah.
that, he did a lot of research and then he was doing this 3D printed tracheas, basically, and then was putting in a bath of stem cell and put it back in patient, that it would be enough. And then when the Karolinska, when people start dying or whatever, and a lot of things that I'm going to spoil for you, they understood that he never did a single animal study. So that's very important. You cannot, bypass that. So what is more important, I don't mind. If you don't do it, somebody else will do, right? The important thing is that whatever you do it not just to go through it because I need papers to get in neurosurgery, but do it because you really believe in what to do. And you will see that the result of your work will be pretty nice at the end.
Yeah, I agree. And I also watched the like this series, and I also guys suggest really to watch it. It makes you reflect a lot when you watch it.
Mhm.
We have a follow-up question from the audience from Jackson Papa. So, considering the relatively poor research culture here in Italy, where about 1 in 20 medical students have a publication, what advice would you give to someone from here who is planning to move to US for residency?
Um, the best that you could do is find so when you are in med school, I mean, I don't looks tell me if I'm wrong. This guy is in med school, right?
I think so, because he
Yeah, I
says
think so,
someone
right?
that want to go to residency. Yeah.
Yeah, so it's hard. It really is because the problem is that they have to know you. So you have to be ready to spend a couple of years after your med school to do some research in the United States, which is not impossible. I know many people who did it. So you need some reason. You cannot show up with zero experience. I mean, if you finish med school and you apply for neurosurgery in America, I promise to you the answer is no. I will tell you right now. Don't even waste your time. But if you instead use those years to look for what you finish today, have a plan for the next couple of days to find a research fellowship, to find an internship, to find a pre-residency, for example. So there is a lot of possibility that allows you to publish few papers. Trust me, you have to publish papers. I agree with you. During my med school, I graduated with zero papers. You know how many paper I had when I graduate my residency? Three. Ask me where I published those papers in Seattle. So I just want to say that it doesn't really matter. What it does matter is that make sure that what you publish or what you do makes sense. So what I did, I told you I was a med student. I went to Giovanni Armenise, and I went there and tried to see, and I wasn't. They gave me $800. Actually $1,600 for like 4 or 5 months. They covered the flight, and my dad is a barber, so trust me, I wasn't rich. So I did what I could to save some money and go there. So my advice is, don't think how sad or how bad is Italy to put. Just it's gonna just kick you in the face. What I advise you, use this time to think, what can you do to help yourself to actually make it, which will be, I cannot publish in Italy, which you can find a way to do it just on LinkedIn, for example. Ask surgeon groups to put you in papers, to ask to do literature review. There's a lot of things that you can do by yourself without having any involvement with your alma mater. So that's what I'm trying to say. That many Italians or foreigner who do residency here. They spend a couple of years doing research, doing some doctorate, doing something before they get into residency, because otherwise it will be pretty hard.
Thank you. I think that this answered the question of Jackson. And Pedro, can you read
Yeah,
the following question? Thank you.
sure. So we have another question in the chat, which I guess I'll add in a little bit of my own question to it. So Kalkidan mentioned here that you mentioned how resilience is important. You mentioned how adapting is important. It's part of what makes us strong. So I guess he asked like how what do you recommend a student do to build their resilience? But the part that I also think like we would really want to hear your input on is how can a student show that they're resilient in their application in their review process, and how does that tie in? Like how do you evaluate candidates who are looking to join your team? We see a lot of the current like publication situation and how difficult it is to evaluate candidates. So how do you currently tackle this situation?
It's not difficult to understand. You just ask their background, what they did in life, how they, and it's the answer are pretty self-explanatory. You don't need much. I can tell you that I remember I had an applicant, and I was in a room asking, I mean, what do you expect for neurosurgery residency? And the answer of this person was, well, I'm pretty confident. I did a lot during when I was in med school. I scrubbed in, and they let me do this, they let me do that. That's already a no-go. No, 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 no. Because what are you showing over there? You're just telling me you have no idea what you're talking about. You tell me as a med student you feel comfortable to poke a hole in somebody's brain. I promised you I can get a teenager to do that, and they will do it. But the point is, you have no idea, and the fact that you are this confidence, it doesn't help your things. I will think the first things I see is how humble you are. Being resilient, it means that people told me story. I had the international student where they told me about their childhood and how they had it pretty rough, and they grew up from a family when they have to go to work during a study. I know there's a lot of things that make a person resilient. You don't have to show anything. Actually, the less you show, the better it is. Just be yourself. That is the best advice I can give. Be humble, be yourself. Students, I was a student. Um, Med students are pretty cocky, right? Oh, I'm a medical student. I'm here, I'm there. That's trust me, this job is gonna humble everybody pretty soon, right away. The first week in the job, you get humbled because whatever you do is wrong, and whatever you do right is still wrong. So I would say be yourself, show that actually you did something in life that is not only waiting. You were proactive. This is what I say about that guy. oh, I went and tried to learn English going there, and then I tried to find this and find that. That is what is resilient. Is somebody who proactively does something, even when things goes wrong, it doesn't stop. It just try to find the next door that opens. So I don't think there's much to show. I really don't have much to teach you guys about that. I just my only advice is be yourself. Don't be fixated about just papers, because I promise we sometimes choose people who have less paper than others, and it's based on personality.
Thank you so much for answering. Like
Welcome.
that, every point you said is like goes with your story, what you talked with us previously. And like changing a little bit about topic, as I heard also in your participation on a Spotify podcast, I would like to know a little bit how do you face the challenges of balancing your clinical and surgical practice, also with your administrative and leadership roles, and also with your, common life,
Hmm.
sports and social, and how do you handle it,
Hmm.
and yeah, how do you manage those?
Okay. Life is made of, everything is a choice. You cannot have everything. You will never have everything. Don't believe in people that tells you that you can have everything, because it's like not right. Life is choices. No one choice is not better than the other, just different. When I become a chief, one of the perks of being a chief, it was that they offer me to put down my clinical time like 15 or 20% lower. So instead of being like a 1.0, it was 80% clinical, because you have more administrative time. You know what I did? Nothing. I just kept my clinical practice at the same level it was before. And so right now I'm working no 1.0, I'm working 1.35. So my work went up 35%, because I have 1.0 that is still clinical, and I do 35%. Say, how is this possible? I do it. I just There's balance, not much. Sometimes your day doesn't end. Sometimes you go home and you have to do all the emails and administrative work, or you have to prepare a bad, feedback you have to give to your coworker about something, and you do it. How did this impacting my personal life? Yeah, it is. In a terrible way, no. I just know that I cannot go out every weekend. I can't. Uh, Sometimes, I'm 39, but I go to bed, I sleep on the couch like a very old person, and it's okay. That's fine. I still, I love going to the gym. I have my PlayStation 5. I play my PlayStation 5. I work out. I still find time to talk to my mom every day and my dad as well. I go to Italy. I try to go once a year. There's a lot of things that it did impact something. It was my choice, because I'm the youngest in my group. So the people under me, the youngest is 43 and I'm 39. So we are a group of young people. So everybody's young, is older than me. So the first things you want to do when you get a position like that is you have to lead by example. And the moment you're gonna shut down or you wanna slow down, people around you, they're gonna start, nothing is gonna work. So what I did, I took a little bit of my private life, I put it into work. So now I have a 35% less in private life, but because I'm working 135%. Is this something I advise to people? No, but that was my choice.
Perfect. Thank you so much. And like getting a hook with this answer, as you said, like being a leader, you need to lead as an example, right? So what skills and skill set do you think a leader should have? Since in surgery and medicine, to be a leader is something that I believe is very important, right? You're leading
Yeah.
a team, a surgery. So what skills do you think people should focus and work on it?
The most difficult skill of being a leader in anywhere, medicine, politics, industries, it doesn't matter. There's only one that is the most difficult, which is humility, being humble. And this is the most difficult one to achieve. if you have achieved that, and you are humble, and you ask, I ask every day. I'm not right every day. I'm not above feedback. Not above. I'm not above um, any suggestion or anything. Now, the moment you have achieved that, well, at that point, everything has become easy. So I'm humble. I try to give people, to make people happy as possible. And then I would say the most tedious one is that you have to learn how to keep people accountable. Nobody likes to be accountable. Trust me, nobody. People think that they are doing the best all the time. And the moment you have to be humble enough, but then you have to keep people accountable of what to do because it's your responsibility, at that point, that's become very hard. Because sometimes being humble, and then sometimes you have to put your feet down and say, like, no, 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 that's how we're doing. That is what is very hard. And then you have to lead by example, means that you have to work. You have to be the first one getting over there and the last one to leave. You have to be the one who, if they call you in the OR, you go. I was home Saturday, and I was not on call. I was just home eating my food, and there was a guy who with a gigantic brain tumor. He decompensated, and my coworker who doesn't do many of those called me, say, Fabio, I don't feel comfortable. Can you come and do it? I just put my scrub on and went. And I was not on call. I was no backup, and I don't get paid more if I operate more, right? My salary is still the same. So to say that you have to be always available. So your door is always open, you are humble, you keep people accountable, and you never stop learning, and you keep working more than you worked before. I think if you put those five things together, I think it's the perfect leadership model. It doesn't matter what to do. Forget about being a surgeon. You could be, a president, or you could be like, the CEO of Microsoft. It doesn't matter. This is what you have to do, in my opinion, to succeed as a leader and make people succeed, below you. That is your job, making them succeed.
Thank you so much.
Yeah.
Okay, so we have a question from the public from Jacopo Rosso Antonino. Jacopo actually is
Sounds
a
Italian.
guy he's from Milan and he went to apply to residency in Milan. He's one of my best friend. He's an amazing guy. So, Dr. Grassia, do you think that residency in Italy has given you good skills for the future? What do you think about residency in the US? And lastly, uh, did you interrupt your practical training during your fellowship? If so, were you afraid of interrupting your surgical exposure?
Uh, okay, let's start with the first part. Then we're gonna go to the first part was, did the residency program give me good skills? Yes, absolutely. Absolutely. I learned so much from everybody. Even when I was not doing much at the beginning, I learned so much just watching. So when I got to America, the reason why they gave me a job is not because they thought I was a good-looking guy. They thought that I was ready for the job. And I didn't get a job because I learned how to be a surgeon that year in the United States. I was able to do surgery myself when I get to the United States because I was taking call at night, and I was doing surgery myself without having the attending was coming, but he was not scrubbing in. And this is because I learned how to do this during residency. So when people in Italy tells me we don't learn anything in residency, that is deeply wrong because you do. If you look enough, if you watch enough, if you present enough. I usually say, my dad, who is a barber, said that if you hang enough outside a barber shop, sooner or later you're gonna get a haircut. Which means that if you wait and you're there, sooner or later somebody's gonna let you do something or teach you something. But you need to be there. You need to ask. You need to steal. I was going to the OR every time. they were starting the case. Even the attending was getting mad. I didn't care because my job was to learn. When I saw the answer is yes, I learned so much. Then when I moved to a fellowship in America as a clinical fellow, I refined and I learned a new skill. But in my fellowship, I didn't. That I told you. Then when I remember the first time I had to clip an aneurysm, if you ask me, Fabio, have you ever clipped an aneurysm in the residency? No, I haven't. You know what I did? I asked one of the vascular surgeon at the university in Colorado to come, and he didn't scrub in. He was behind me, and I told him, I think I know how to do it because at the best I think I was seeing I saw maybe 150 of these, maybe 200 aneurysm in 1 year. I think I remember what they were doing. You stay there. If I need you, you scrub in. He was absolutely yes. So, and I did it. So this is just to say that even if you never did something, when you saw it enough, your brain is smart enough to put your brain and hands together and you're gonna make it happen. Be humble to ask for help at the beginning. That's what you have to do. I ask for help even now. What was the second part, which is so I forgot it.
Oh yeah, it was just like if you were able to practice surgery in your fellowship, and if not,
Which kind of fellow? He's talking about the clinical fellowship in America.
yeah,
Oh,
exactly.
you have to. That's your job. It's,
Okay.
it's, but you need to have already your USMLE. You need to have a license. You already have full trained surgeon that practice under an attending, but you have to do so. That is the requirement of the fellowship. I mean, they will not gonna take you, otherwise.
Sure. Um, and I have a follow-up question on that. Like, do you think that now that, for example, there are so many more positions in residency neurosurgery, it is still the same quality it was when you were a resident there
In Italy or
in
in
Italy? In Italy.
I think it's still the same. I think residency in Italy got better in the last 10 years. I think every year they're getting better for a lot of reasons. Now you guys are more open to the world. You know that how things are. You don't accept, those old people who tell you that it's such a difficult job that nobody else can do it beside the chairman. That's not true. I can tell you right now, that's a bullshit. That's wrong. That's no. So because everybody's open, because things like that, when you talk to me or you talk to other people, you realize that actually, and as you realize, people in the residency they do as well. So I think actually the quality of residency I think is getting better because there is less idea that only those same 3 4 people can do something. So they actually are teaching a little bit more. So I'm actually very pleased with what Italy is teaching. When you finish Italian residency, are you a full surgeon? No, you don't. It will take you a few years after to become a complete surgeon, 100%. But you don't have to be. You have to be, and when I talk to everybody, I say, don't take my example as the goat because I was lucky. I was in one of the best hospital in the world, which is the Neurological Institute in Milan, Besta, and I was the only one resident and slash fellow, call it whatever, for 8 months. That is a unique situation. Whenever it happened, you are basically 4 attending, 1 resident, 5 cases per day, acoustic schwannoma, moya, aneurysm, glioma. Acoustic schwannoma, pituitary adenoma, posterior fossa meningioma every day, like for 5 days of the week. That's never happened. So this is, I say all the time, don't take my example, but even people who were not in my position, they're still doing fine. They just have to find their own way.
Thank you for that answer. I would love to hear about, neurosurgeons is such a competitive field. I would love to hear about what people can do, in your opinion, to have a chance at this field, and what advice and mentorship would you give them in that area?
You have to be, you have to accept failure multiple times. People are gonna tell you that you cannot do it, that is impossible, that forget a change field. You have to know that this is gonna happen, and every time somebody punches you, you go down. You're just gonna wake up again and keep going forward. So I think everybody has a shot in this field, And if you don't, it's because you gave up. I know people in America, but not only in America, guys. You can do neurosurgery all around the world. Nowadays, everything is pretty, leveled. Neurosurgery is standard of care is like that here, is like that in Germany, in France, in whatever, because more or less able. So wherever you go, you just have to be persistent. I would say usually that, if you don't have a commitment, you basically don't gonna start anything. But if you are not persistent, you're not gonna finish. So you need commitment to start, persistent to finish. And this is something that a lot of people, especially people, young people, they have a lot of commitment, but the persistence is lack because everything needs to be now and done. There's no way of waiting a few years or whatever. That's in surgery is not gonna work again. If you want everything right away, first day in surgery, you will get slapped in the face by life pretty hard.
Thank you.
You're welcome.
Thank you, Dr. Gracia. So we have like 4 minutes until like the end of the webinar. So I think maybe I can ask just the last question from the public. So what do you look for from in students you personally are willing to mentor by Kalkidan?
That's nice. I'm one of the mentor for the University of Colorado. I receptor. I get a lot of students every year. Curiosity, um, and so curiosity number one, being patient, asking the right question, and being humble. That's enough. If you're curious, you show me that you ask me question, that you actually read something about it, that you are not in a rush, that you're humble to listen and learn, that you don't know everything, like I don't know everything. That's to me is really, really enough. And then this is a little personal. I want you that you have something to do in life that is not totally thinking about being a doctor. Have something else. Go do sports, go out, go to dance, go to party, do something that is not just being a doctor, because that is very scary. I don't like scary stuff.
Yeah, please, guy, don't like cure other people without take like
Okay.
your health seriously because it's important.
Mhm.
So thank you, Dr. Gracia. I think this was one of the most like but one of the better webinar we had, and thank you for being such a honest person. Uh, and we are just so happy to have you, and we hope maybe to have you in the future for another
Yeah.
occasion. Uh,
Everybody, you guys can reach out to me. You have my email, you have my contact and social where just reach out to me if you have any question. I'm happy to answer.
Thank you so much, guys. And we would just want to remind you that we have another webinar on the 24th of November with Dr. Odette Harrison from Stanford. And she was the first Black woman to become a professor in neurosurgery in Stanford. So please, Guy, come and we are happy to have you every time. Bye.
Bye bye.
Bye,
Thank you,
Graham.
Dr.
Thank you
Gray.
so much.
Bye.